What are the symptoms of vestibular migraine?
There are many symptoms, right? So I think you alluded to some of them earlier, meaning, vertigo and dizziness. It's always important to clarify what we mean by vertigo and what we mean by dizziness. So vertigo is essentially a sensation of motion when there is no motion. So you may feel that you are moving or your environment is moving. It can be spinning, rocking, tumbling, falling through space, floating, swimming, these types of sensations. Some people feel that the ground may be moving or tilting. And dizziness, on the other hand, is more of a sensation of rather non-specific disorientation without the sensation of motion. So, you have symptoms like lightheadedness, for example, sensation of queasiness, things just don't look right, things don't feel right, as if you're wearing the wrong glasses, for example. That essentially falls under the umbrella of dizziness. You also have postural symptoms, meaning, symptoms you experience while you are upright, while you're moving around. So, the most common one, of course, is, when a person is upright and walking, they feel off balance. In some cases, some people may experience a sensation that they're being pushed or pulled in a particular direction. Of course, these symptoms have to be accompanied by migraine symptoms, right? And if we look at the diagnostic criteria for vestibular migraine, you should have either the typical headache of a person experiences when they have a migraine attack, light and noise sensitivity, or visual aura. Now, of course, outside the diagnostic criteria, we have plenty of other symptoms that we can also experience. So you can have, you mentioned tinnitus, so a lot of hearing symptoms or ear-related symptoms, so pressure in the ears, tinnitus. It can even be ear pain, ear pressure, weird sensations like, vibrating feelings in the ear, itching in the ear, like little bubbling noises. Many different ear symptoms, have been recognized as, being related to migraine. Now, of course, they're not part of the diagnostic criteria, but they're still important to recognize. Some patients may experience a bunch of visual symptoms. You can have things like, blurry vision, very non-specific, but very commonly described in our patient population. Some patients experience double vision. So it can be horizontal, meaning side by side. It can be vertical, meaning one on top of the other. Some people experience visual snow. So vision looks as if it's pixelated. Some people have rather unusual symptoms, right? So for example, palinopsia, where, you look at an image and then you turn away until you see the image playing in your vision. Some people also, experience, changes like what we call Alice in Wonderland type of symptoms visually, where objects may appear larger, smaller, closer, further away, split in half. Very bizarre type of symptoms to any person who's not familiar with migraine would think, highly unusual and perhaps they could psychiatric in nature. Sometimes you may experience even like autonomic symptoms. So some people experience diarrhea when they're having one of these attacks. They turn pale, they get, very sweaty. Some people turn really red, get flushed. Their ears may turn red. Some produce more tears. Mouth may get dry. Nose may start to run. Eyelids may get droopy. So any symptom can occur in vestibular migraine.